Welcome to our heart health class for our Health and Harmony family. This last month, we completed the detox. Many of you went through the 10-day metabolic detox. And this is our second step on our journey to health to make this year healthiest year yet. Now, why heart health? Well, for one, February is National Heart Month. It's also the month of Valentine's Day. But heart health is the number one cause of death in the United States. When you combine cardiovascular health with strokes, it equals 800,000 to 900,000 people a year die from cardiovascular disease. And that averages out to be one every 36 seconds. So just over the course of our conversation this morning, that means that anywhere from 50 to 60 people will die because of cardiovascular disease. And this isn't something that happens later in life. They've shown with studies that as early as the age of 5, they find that 25% of children at age 5 are showing plaquing. And by the time we get to our teenage years, we're seeing that in teenagers ages 15 to 19, 60% of them are showing plaquing atherosclerosis in tests. It's 1 out of 3 people that are affected. And you start looking at your family, maybe a loved one, your children, friends, 1 out of 3. That means it's you, a spouse, a child. It's something that is affecting us. It's affecting Evergreen. It's affecting this mountain community. But the good news is that we can make changes in whether we have a risk of having cardiovascular disease through lifestyle. In fact, it's the number one way to improve or decrease your risk of cardiovascular disease is through your lifestyle, your diet, exercise, the supplements you take. Now, cardiovascular disease hits close to me. This is a picture of my grandpa, my mom's dad. His name's Warren. He's one of my heroes in life. As a child, this is him at my wife and I's wedding 10 years ago. Now, my dad's side, my grandpa Raymond, I have a picture like this with him, but I don't have any pictures growing up with Raymond. I don't have any pictures of him at my wedding because he died of a heart attack when I was just a child. He never got to see me grow up, never got to see my dad raise a family. And so while it's a family predisposition, it's also, there's a lot that we can do through our epigenetics, through our diet, lifestyle, supplements to change the course so that we don't have to go down the same path as what family members have. I'm just curious, how many of you, there's quite a few of you on now, you can just share in the chat. Do you have any history of cardiovascular disease in your family? Is this something that hits pretty close to home to you? Just go ahead, write yes in the chat, maybe how it affects you. There was a study that they did at Northwestern where when they looked at 5 lifestyle factors, and this was smoking, weight, exercise, your diet, and alcohol, they showed that by addressing all 5 of these factors, that the participants had a 10 times improvement, 10 times less risk of cardiovascular disease. And what was interesting about the study is that if the participants just did one category, like they stopped smoking or they improved their diet, it only decreased their risk of cardiovascular disease by 6%. But when all 5 categories were addressed and improvements were made, it decreased their risk by 60%, which was a 10-fold increase. And so when it comes to your cardiovascular health, the most important thing is to get tested. You know, there's a saying with heart health that healthy people have a nasty habit of dropping dead. You know, we've all heard of the story of somebody that's doing the triple bypass or running, and then the first sign of cardiovascular disease is a fatal heart attack. In fact, a lot of disease, a lot of conditions are that way. Cancer, even a blown disc, migraines. We see that often these start much earlier in life, but by the time they manifest a symptom, they can be very problematic or even fatal. So we're going to talk today about what are the tests that we need to do to help make sure that we have a cardiovascular system that's healthy. And if there's tests that are out of line, what we can do to start moving those back into the healthy ranges. So these are the tests that we're going to talk about. Your HbA1c, your C-reactive protein, vitamin D, cholesterol profile. We're going to look at the ratios there, not just cholesterol, cortisol, subluxation degeneration, and then your waist measurement, your BMI. We're going to start with this HbA1c. Now, HB stands for hemoglobin. HbA1c often is associated with diabetes. So you can have a fasting blood test where you look at your glucose, or you can have this HbA1c. And the HbA1c looks more at what your blood sugar's been doing over the last 3 months. Now, what's interesting is that it's also a progressive measurement for heart health. They're showing that people that have higher percentages of HbA1c have a greater risk, as you can see, of cardiovascular disease, coronary disease, having stroke. So when we have that HbA1c tested, the range that we want to see it in is this 3.5 to 4.5%. When we start creeping above 4.5%, that's where we start having a greater risk of cardiovascular disease. This shows that the test that we do through the office here, and you can see right here, this is that HbA1c. It's a percentage. The healthy range is down here at that 3.5 to 4.5. As we start creeping up here, like this one's at 6.2, this is going to be somebody that has a much greater risk of having heart disease than if they're closer to that 4.5. The next one that we'll look at is C-reactive protein. Now, many of you had this tested this last year because it's associated with inflammation. It's not specific to the heart, but when you see high C-reactive protein, that means that your body's in an inflamed state. And that inflammation, with having higher LDL, higher triglycerides already floating around in the blood, that can lead to oxidation of those triglycerides and LDL particles, leading to plaque and atherosclerosis. In fact, they've shown if a person has a heart attack and then they get their C-reactive protein levels down, their risk of having a second heart attack is dramatically reduced compared to people that continue to have that elevated C-reactive protein. And when we measure C-reactive protein, it's also a blood test. It's a scale of 0 to 1, and then beyond. The healthy range we look for is to be at 1 or less. As soon as we start seeing it creep above that, like this test here, which is at 6.4, that's somebody that's in an inflamed state, greater risk of oxidation, greater risk of causing damage to the blood vessel linings, leading to that plaquing, atherosclerosis. The next test, vitamin D. Now, interesting, we talked a lot about vitamin D as it relates to immune function this last year. Low vitamin D levels, low immune function. It's also critical for heart health. They've shown that low vitamin D levels is associated with having more of that arterial disease, cardiovascular disease, high blood pressure, congestive heart failure. And the sweet spot for vitamin D is that 60. It's a scale that goes from 0 to 100. We want to see it right in that 60 range. If it's less than that, and many of the patients that we tested over this last year were even down in the teens, 12, 13, 14, then we need to start really working to bring it up to this 60 range. This shows that test. And this patient here, 0 to 100, she was right at that sweet spot of 64. Next test that we look at is cortisol. And cortisol, you think of that associated with your adrenals. It's a stress hormone. Now, if you have too much cortisol, like you're in a stress state and your body's producing excessive amounts of cortisol, that is associated with what's called metabolic syndrome. That's a person that ends up getting more of that abdominal fat. Now, on the other hand, if the adrenals are depleted, you've been in a high stress state for a long period of time, and then all of a sudden your adrenals are just depleted and you can't produce cortisol. Cortisol helps keep inflammation in check. And so people that have low cortisol are shown to have higher inflammation. So I'll show you what that test looks like. It's an interesting test because all the other tests are blood tests that we've talked about so far, but cortisol is a saliva. And when we take a cortisol test, we do 4 of them. We take a sample in the morning at noon, in the evening, and then at night. And that way we get a snapshot, what is the cortisol doing throughout the day? So in this particular test, you can see down here at the bottom, first thing in the morning, that cortisol came up into a really healthy range, which is what you would expect. You're waking up, you want that cortisol to rise, and then your melatonin levels decrease. But then as the day went on, this person, by the time they got to noon, their cortisol dropped out to 0.4. By the time evening, it was low, and then going into bed. So this is somebody that wakes up with some energy and then just crashes as the day goes on. And this would be a sign of depleted adrenals, low cortisol, and that's going to be associated with greater inflammation in the body, which we see when we look at this test. We see that higher C-reactive protein, and then we also see that really high HbA1c. Now, the next test, cholesterol, triglycerides, LDL, HDL. And we're all familiar with this. And cholesterol often is just given a bad name, like, oh, I don't want cholesterol. But it's more important to look at the ratios than just to look at the total number. So when we look at cholesterol and we talk about LDL, HDL, that HDL, that's the healthy cholesterol. That actually has some antioxidant properties to it. And the range that we want to see it in is 50 and above for both men and women. Not 40, not 45, that 50 and above. And then when we look at the LDL, we look at the ratio of what your LDL is compared to your HDL. And we want to see that ratio 3 to 1 or less. So I'll give you an example. If your HDL is 40, 40 times 3 is 120. We want to see those LDLs at 120 or less. If we start seeing those LDLs raised above that, we have a greater risk of heart disease because those LDLs are going to be circulating in your bloodstream, and there's a greater risk of them getting oxidized, leading to that plaquing atherosclerosis. Triglycerides, the number that we're shooting for is 150 or less. When we start creeping above that, again, those are circulating freely and they can become oxidized, leading to more of that plaquing. We actually look at some ratios, the total cholesterol to HDL ratio. So that's looking at what your total cholesterol is, dividing by that HDL. And for men, we want to see that ratio at 3.4 or less, and for women at 3.3. And then for the triglycerides to HDL, the closer to 1, the better. So 1-on-1 ratio, but we don't want to see that ratio go above 2. Anytime that there's twice as much or more triglycerides than HDL, again, we have a greater risk of this happening, where those particles are floating through the bloodstream, they get oxidized, they start damaging the interior lining of the blood vessels, leading to the plaque getting laid down. And then over time, we get constriction, blockages of those vessels, leading to cardiac problems. Now, cholesterol medication. So 20 years in practice, I can't tell you how many times I've had patients come in that tell me, I'm really healthy, and they're on cholesterol lowering medication, they're on blood pressure medication, and not doing anything in their life with diet, exercise, supplements, just purely taking those medications. And that would be like when a patient comes in with headaches and they've been taking 16 ibuprofen a day, which I've seen, and that was only after they stopped taking Tylenol because their liver started to fail because of all the Tylenol. Sure, they're not getting the headaches, but they're also, the underlying cause of the headache still exists, and they're causing liver and stomach damage. So cholesterol by itself is not bad. 60% of your brain, the sheaths of your nerves are made up of cholesterol. It's just we need those healthy ratios that we talked about. More of that HDL, less of the LDL, keeping those triglycerides in check. But cholesterol, if we're on that medication long term and not making other changes, we can see it lead to peripheral neuropathy, other cardiac problems. It starts to decrease the coenzyme Q10, which is a really important antioxidant in the body. It can lead to depression. So we're going to switch gears now and start to talk about what are things that we can do from a functional health perspective to start to have a positive impact on those numbers. And functional health just means what are things we can do with our diet, our lifestyle, exercise, supplements to make a positive impact on our cardiovascular health. First one, diet. And this one, it spans across for a lot of conditions. For cardiovascular health, the carbohydrates. When we start reducing or completely eliminating simple sugars, sodas, fruit juices, those refined foods, chips, cereals, that has a very significant impact because those simple sugars are shown to increase atherosclerosis. They actually increase triglycerides, which we just talked about. We want to see a lowering of that. Simple sugars increase the bad cholesterol, the LDL, and they decrease the good cholesterol, the HDL. They create some insulin resistance, lead to more obesity. So as a first step with diet is just eliminating or reducing those simple sugars. And that was one of the things following this detox that was exciting to see, is that many of you said it just became easier. You didn't have the sugar cravings. It was easier to make better food decisions because you weren't getting drawn to those simple sugar foods. Studies have shown as soon as we start reducing the simple sugars, dropping the carbs, we see decrease in the triglycerides, and that good HDL starts to rise fairly quickly. Now, the diet that I recommend would be a modified Mediterranean diet. So that's going to be a diet where you're having more of your carbohydrates from fruits, vegetables, not from those refined sugars, refined flours. And then it also has the healthy fats, healthy oils. Modified Mediterranean is going to be really high in that olive oil. Olive oil has been shown to be really beneficial for raising HDLs. And not just olive oil. If we look at if we look at coconut oil, getting more of the omega-3s, which comes from fish, those also have been shown to have a really beneficial effect on raising HDL, lowering those LDL cholesterol. This is a list here of the healthy fats: olive, fish, coconut, raw nuts. Those of you that were on the detox, such a treat to get back to being able to have those on day 9. More of the organic grass-fed meats, vegetable meats. And the reason they're organic grass-fed is that right before they go to the meat processing plant, they don't end up in a feedlot where they're just filling them full of grains, and that really can affect and change the way that meat's broken down in your body. And then, of course, avocado, flax, chia. The ones that we want to avoid, those trans fatty acid, the fried foods, canola, vegetable oil, and then more of those commercial, more processed dairies and meats. Inflammatory foods, and this is that list right at the top of it: sugar, the juices, the chips, vegetable oil, fried foods. As we go down this list, the more inflammatory foods that we're eating, as far as your cardiovascular health, that's increasing the risk of you having that higher C-reactive protein, causing those fats in your body that are circulating to get oxidized, leading to the plaquing, leading to the atherosclerosis. So avoiding or completely eliminating these off of our choices of food. And then working to bring more, not just the fish, coconut oil, olive, avocado, green leafy vegetables are awesome for helping to decrease LDLs, raising those HDLs, raw nuts. And then there's something called the glycemic index. And the glycemic index is how quickly that food burns up once we eat it. If it has a high glycemic index, we eat it, it's kind of like throwing pine needles on a fire, burns up quick and then it's gone. There's nothing to sustain you. And then you're wanting to eat again, burns up quick and it's gone. Low glycemic, which is what we're shooting for, when we eat those foods, it tends to burn like a log, like an oak log. It takes a little while to get on fire, but once it burns for a long time. So we have that feeling of being full, but we're also not creating as much inflammation in our body. We're not creating that insulin release, and it helps keep our body better balanced, which helps with our cardiovascular health. You know, one little side note on here too is we do that comprehensive food environment test, which really looks at all the food categories, environmental categories like molds, pollens. And that's another step deeper to look, because you may be eating good oils or having good fats, but if you have a sensitivity to those, you want to find that out, because all the avocado in the world may not be good for you if you have a high sensitivity and it's creating more inflammation in your body. Now, let's talk about some specific cases. So first, we look at moving to that modified Mediterranean diet. Then the next thing is if there's some specific cases, like you have that high HbA1c, high triglycerides, like we saw in the case that I just was showing you. One supplement that we like is something called GlucoAdapt. It has chromium, some other herbs in it. This has been shown to be really effective for helping to bring that blood sugar down, helping to bring those triglycerides down. Another is when we move to that C-reactive protein, the fish oils, getting 1 gram to 3 grams a day of fish oil, a good omega-3, that can help lower that C-reactive protein. Plus, we like these two products here in the office, Eflamex, another one called flavonoid that have the curcumin in them. And that's just a really concentrated version of turmeric that's been shown to help reduce that C-reactive protein. Magnesium is also a strong anti-inflammatory, so you want to make sure you have a good quality multivitamin that contains magnesium. We like the Wellness Essentials packs as well as the Edison pack. This is what the Edison pack looks like. These products have that magnesium, which has been shown to help keep the inflammation down in the body, again, reducing your risk of cardiovascular disease. And then niacin, and some of you, we've talked about niacin. Niacin is pretty interesting. It's a vitamin B, vitamin B3, and it's been shown that with usage of niacin, you can lower the LDL, increase the HDL, and help reduce triglycerides. Now, the dosage that we shoot for is 500 milligrams a day, but niacin can create flushing, and so we'll often start a patient at 1/4 of that or 1/3 of that, and then gradually over time increase that sustained release. And sustained release niacin just means it doesn't just hit your blood all at once. It slowly starts to release in the body, so you have less chance of having that flushing response to it. But that still can be really common as patients are using niacin to get that, but it has been shown to be really beneficial for your cardiovascular health. And then for the adrenals, so we looked at that situation where the patient had depleted adrenals. We like a product that's called Adrenal Care. And with Adrenal Care, your goal isn't that you're stimulating the adrenal glands or that you're decreasing, you're just supporting them. And a lot of functional health works that way, supporting the adrenals so that they can do what they're designed to do. And this is a great product, especially when we see it depleted, like in that heart health test that I was showing you. Vitamin D, that magic number 60. If we see somebody down in the teens, which I mentioned, we've seen a lot of this last year, then we look at supplementing anytime they're below 25 of 10,000 international units a day. And the product we really like is a vitamin D3K. This is the example one we use in the office. That vitamin D3K has been shown in studies to be more bioavailable. When you take it, it gets into your body, gets into your bloodstream. If we see somebody less than 60, but they're above 25, instead of starting at that 10,000 a day, we'll start at 5,000 a day. And then after 90 days, retest. And that's an important thing with all these things, is that we don't guess, we test, is that we come back and we look and see, all right, are we at the sweet spot we want to be? Do we want to increase or decrease that depending on what the test results show? Now, exercise. Obviously, heart's a muscle. Exercise is really important. As a general rule, 150 minutes a week of moderate exercise. So what would that be? That would be like a brisk walk. Going for a brisk walk, 30 minutes, 5 days a week. That's been shown in studies have a significant impact, helping improve your cardiovascular health, reducing your risk. Now, if you increase the intensity from moderate to getting to more higher intensity, you can actually cut the amount of exercise that you're doing in half. So if you went from a brisk walk to a jog, or say you're swimming more vigorously, you could do in 75 minutes, have the benefit on your heart that 150 minutes of more moderate exercise will have. And something that's become really popular in recent years is what's called interval training. Maybe you've heard of HIIT training, high intensity interval training. That's where you'll take, and maybe you're on an exercise bike and you'll go as hard as you can for a minute, and then you'll go slow, more of a rest mode for a minute. Then you go hard as you can for a minute, and rest mode for a minute. And they've shown with that high intensity interval training, you can actually reduce the amount of time of exercise you're doing each week and still have a greater impact on your heart health. So exercise is important. That high intensity interval training is shown to be very beneficial for your heart health. Chiropractic care, most of you on this call are under chiropractic care. Kind of two really interesting factors with chiropractic care. One's what's called your heart rate variability. That's this HRV. And that's a measurement of the space between heartbeats. And what they found is that the longer patients are under care, they did it over the course of a year, the better their heart rate variability measurements came back. And what that means is that they moved into more of a parasympathetic state rather than a sympathetic state. And the parasympathetic state is your rest recovery. Sympathetic state is more fight or flight. And so with better heart rate variability numbers, people were more adaptive when stress came up, lower risk of high blood pressure, and heart problems. The other thing is just the direct innervation from the thoracic spine and from what's called your vagus nerve down into your heart. And we've known this, they've done studies as far back as 1965 where they were showing lesions in the spinal column, which we call subluxations, increase the risk of cardiovascular problems. And that's related directly with the innervation of these nerves that are going out from the spine and to the heart. And so we look to see, are there areas of subluxation? If they've been there for a period of time, we'll see this degeneration. Based upon what phase of degeneration you're in, we put together a corrective and a maintenance plan so that we keep these nerves healthy so that your heart can continue to function the way that it was designed to, with messages going clearly from the brain to the body, down to the heart, heart back up to the spinal cord, back up to the brain. And then this last measurement, your waist circumference. At a really basic level, just taking a measurement, taking something like this and measuring right above your pelvis. And you want to see for men that the magic number is 40 inches or less, for women 35 or less. When we start creeping above that, that's an indication of we're carrying more fat, especially in that abdominal region, which is a greater risk factor for cardiovascular disease. Another one that I really like is your body mass index, BMI. And there's different ways to calculate it. There's a calculator, if you Google after this class, Mayo Clinic BMI. It's a nice one because when you go on there, it's going to ask you for your age, your height, your weight, and your waist measurements. And then it gives you numbers. And sometimes those numbers can be hard to take when you look and see what's normal, what's considered overweight, and what's considered overweight. And so we'd be glad to do that for you here in the office, or you can also go online and check out that calculator and check out your BMI. And the take-home message with that is that cardiovascular disease, often silent killer. You don't know it till you have a heart attack. 1 out of 3 people die from cardiovascular disease. It's affecting somebody every 36 seconds. And so get tested. There was a patient, I'll tell you the story, fall of 2019 came in, severe headaches affecting his work, affecting his marriage. We found subluxation in his neck. We started him under treatment and he did awesome. Headaches went away, continued under maintenance care, headaches stayed away, but you could just tell he wasn't healthy. Hard time getting on the table, off the table, often shortness of breath. Started talking to him about what was going on with his overall health picture. And he said, well, I'm getting a bunch of liver tests done. And by the time those liver tests came back in the end of November, they were negative. I started talking to him about his heart health. And he said, you know, I'm going to hold off on doing anything. I'm going to do it through my medical doctor, but we're going to wait till January because I got a new supplemental plan on my insurance that'll cover some of the tests. And I'm just going to wait until January. Well, I saw him again in December. Then his next appointment was that week between Christmas and New Year's. And his wife called us just before his appointment, said that he wouldn't be making it in. And when Madison went to reschedule him, she said, well, just before Christmas, he had gone downstairs to wrap gifts. didn't come back upstairs after a long period of time. She went downstairs and found him dead, laying next to the gifts, because he died of a heart attack. So I made a commitment after that. It's like, we're going to start talking about this with you, because we care about you. You know, your number one priority, we want to keep your nerves healthy, and then start making steps to improve your health in this journey that we're going on in 2021. So get tested, know your numbers. And once we know your numbers, then we can make some specific recommendations. But on a whole, this is where I recommend starting. Make sure you start following more of that modified Mediterranean diet, reducing those simple sugars, reducing the refined oils, fats, putting more of those healthy fats, the olive oil, coconut oil, avocado, the raw nuts into your diet. At the same time, work on increasing the exercise. And the beautiful thing about the HIIT, high intensity interval training, is it takes less time, but you get more benefit from it. Make sure that you're getting a good multivitamin. We like I said, that wellness essentials or this Edison pack. Fish oil, make sure we have the right amounts of vitamin D. And then again, get tested. Let's make this year our best health year. And you know, we're on this together. You know, I have a family history of it. It's important to me, and it's important for me, for you, that you stay healthy and that you keep your families healthy. So thanks for joining me. Our next class is going to be in in March. We're going to do a weight loss class, taking this diet a little deeper and looking at ways that we can use our diet and supplements to reduce weight, and especially with an eye to getting ready for the summer. So thank you. Stay healthy, stay adjusted, and be kind. Goodbye now.